Measles complication can be severe, and children as well as adults are more likely to suffer from the effect of its complication, including pneumonia and encephalitis. To prevent the spread, Edo State Primary Health Care (PHC) on a one-day sensitization held in Benin City say it is now ready to work together with media organizations in the state to ensure several measures, including vaccination campaign, are taken to various communities. Speaking to newsmen, the Deputy Director of Disease Control and Immunization, Dr. Esiegbe Efomo, identified the need to work closely with media partners in the determination of critical information that will bring about a positive impact on the immunization campaign.
I'll take the message to national that today Edo State is having engagement with the media for the success of measles.
To 1 year. So please, I will beg you all to help us spread this news.
Right now, we're preparing for the measles campaign. The last time we had a measles campaign in Edo State was in 2018. But measles vaccine is part of the routine vaccines that our children get routinely. So we're doing this campaign to ramp up the immunity in our environment against measles, and we're targeting children below 5 years of age. People can make their children available to get these vaccines and be protected from the measles disease. I would just like to add that just now we're also trying to introduce the Rota vaccine to protect our children against diarrheal diseases. So the federal government is just introducing that now into the routine immunization. So we're going to be having an integration of the Rota vaccine administration and the measles vaccine administration during this period for the measles campaign.
The measles is a childhood infection. You know, it affects children less than 5-year-old more than adults. So it's a disease that is easily transferable. So we have to ensure that our stakeholders are involved to push the message out there. So we believe that after these engagements with the media particularly, our messaging out there, communication will be easy. This is for our children, this is for our generation, you understand? So when we have healthy children, we have healthy adults.
So the essence is to make sure that no child in Nigeria comes down with measles. Now, let's not speak for Edo. No child in Edo State comes down with measles. The same for Rota vaccine. Why are we doing that? Because we find out that there's diarrhea now, like outbreak of cholera, outbreak of diarrhea all over. So we are trying to also make sure that we vaccinate our children so that we don't have a case of vaccine preventable diseases being rampant in our society. That's why we are doing this too. So for measles and for Rota vaccination in Edo State.
Osunde Osagbovo Masi, reporting from Crusader TV News.